Hey guys, welcome back. Many students suffer and they fail step one because pharmacology. Pharmacology equals points. All my students in my classes, I teach them that pharm equals points. I want to show you in a couple of seconds how knowing pharmacology gives you the leverage to score well so you can maybe miss a few questions, still pass step one, right? Let's go to the question. Always read the last three lines. The physician prescribes a drug that blocks peptide transfer by binding to the 50S subunit. 50S subunit. Automatically, what I think to myself is this. Take the first 8 out. Buy at 30, sell at 50. So the 30 S's are aminoglycosides, tetras. The 50 S's are chloramphenicol, clindamycin, erythromycin, and linezolid. You need to know this information. You need to know the first 8 mnemonics. It's going to make life a lot easier. So if you know the 50S subunits, guess what? Take out everything that you see that's not 50S related. This is out, this is out, this is out. Clinda stays in, azithromycin stays in, this and this is both out. Then, in a matter of seconds, you bring it down to 50-50. Okay, now you have to go to the top and read the scenario. A 51-year-old man with alcohol use disorder comes to you because of fever and productive cough. X-ray shows right lower lobe consolidation. Ding, ding, ding. Diagnosis is aspiration pneumo. This is where you need to know the knowledge. There's certain medications that you give for anaerobic infections. Clearly, these two are inhibiting 50S. So there is no mistake here that you're down to 50-50 by knowing the mnemonic, right? Mnemonic is buy at 30, sell at 50. They're all here. But you need to know that the medication you give for aspiration pneumo, anaerobic infections will be clindamycin. Clindamycin is given for anaerobic infections above the diaphragm, metronidazole below the diaphragm, right? This is what I mean when you're studying hard for step one. You need to be able to use questions like these with the first 8 side by side to get the points. This is what I do each and every day with my students, and this is why I created the QBank Video Library to make sure that whatever QBank you use, whether it's Amboss, UWorld, Kaplan, combination of the QBank plus my videos will allow you the leverage to be more efficient and effective on exam day, all right? If this has been helpful for you, all you need to do is jump on, grab my QBank Video Library. I'm increasing the videos every week. Before you know it, you know exactly how to get the points to pass your step one.